There we go.
Ooh. I've dealt with dysfunctional erection problems, like with the little guy downstairs, and I get an erection.
38-year-old Santiago did not come in for male issues. He came in for radical neck, mid-back, and low back pain, unresolved for years. Here's his x-rays. Woo-wee!
He relaxed much better, see?
Whoa. First name Santiago, age 38, and work union electrician. For the past 5 years, since 2018, I've been dealing with neck pain, mid-back pain, and lower back pain, and after that it triggered all type of pain throughout my whole body.
Causing anxiety, depression, all that kind of stuff, right?
Insomnia.
Gotcha.
Pretty much exhausted and depleted the medical system. Been through all practitioners, over 50 physical therapy appointments, pain management specialists, orthopedic, bone surgeon, acupuncture.
How about chiropractic? What have you done for chiropractic?
Just once.
How long have you been watching my channel?
For the past 4 years.
Work comp has not helped him at all.
Not
He
at
has,
all.
you know, he filed a work comp 5 years ago. He can't stand anymore. He's not going to wait. He's just going to pay out of his own pocket. Headaches, carpal tunnel. We have numbers in the fingers, right?
Yes.
Constipation.
Oh, yes.
Yes. How often do you go to the bathroom a week?
2 to 3 times.
2 or 3 times. Vertigo 2 or 3 times a week. Low back pain, sleep, anxiety, depression. Left ankle too.
I'm sick and tired of being in constant, never-ending pain.
You can feel the depression coming out in him, and can't wait to give this guy his life back. How much pain in your low back there, sir?
8.
How about that?
8.
How much pain there?
7. 8.
How much pain in your legs, your back?
It's an 8.
It's an 8. Stand up. You can see the imbalance right there. Stand up on your toes.
It's an 8.
And you can see his balance problems too, guys. Tell us about your headache right now. How much is your headache?
It's a 7.
Let's get you up. Look at his x-rays. All the normal things are there. High neck reverse curve, has arthritis at the lower part of his neck. Atlas is probably 1/2 wear. The interesting part is he has a wisdom tooth, and the wisdom tooth is completely sideways. The jaw can influence the neck too.
We have 8mm right imbalance, occiput, and TMJ issues. Here we have a short right leg and constipation, 1/2 atlas wear, high neck reversal, and arthritis. Here we have a sway back and continuing arthritis.
So we're going to go right through his high reversal. Just bring your head towards me. He's excited, but he's nervous still because you can feel he's not letting go. Let go, let go. Yeah, he's not letting go. So we just got to get his body relaxed so we can get a good adjustment. I'm just going to set up on his neck, and he's going to say, ouch, when I push right here. He can feel all this crap right there. Yep, and that's where I'm going to go right through, guys. Just let your head drop on the table, please. No, drop. He's not letting go at all. He's not letting go. He wants it, but we have to surprise him. Gotcha. What'd that feel like, dog?
What a relief. I feel like as far as my peripheral vision, like it widened
feels like
up.
HD, right? Feels like,
Like-
yeah. I hear that all the time, guys, because cranial nerves are affected dramatically by neck adjustments. And so what's a cranial nerve? Those are the nerves that go to our eyes, our ears, our taste, our sound, all those kind of things are inside our head. And you're like, how do you affect that? Balance in the body does it. And so he's already more relaxed than last time. I'm going to go right through here. Still sensitive,
Yeah.
And that's why we ice at night, guys, because we want to get through the sensitivity. Come this way. Yeah, he relaxed much better, see?
It was harsher than the first one, but
Yeah.
the actual initial snap, it's tough, but after
We call that
it's-
Snapalicious.
As many of you know, I like to help my patients up after their first adjustment. We're also reminding him not to twist and turn or he will undo my work. Now we're going to check in to see how he's feeling after his first adjustment.
Right now, my vision is readjusting. It's blurry, but it's
Changing.
It's refocusing. Less pressure on my lower back. My neck feels slightly lighter. Less build-up pressure, tension. Even my jaw. Because I grind my teeth, like right now it feels more relaxed.
How about your hearing?
Because normally
How about your hearing? Any difference there?
It is enhanced.
Yeah, a little bit, right?
It's a little bit more amplified. And I do have hearing loss, and it feels like I've increased it. Even my voice sounds a little bit different.
Time to recalibrate the spine. Walking down the hall spreads that adjustment from the neck all the way through the entire skeleton. Let's see how he's doing now.
My bones are snapping and popping in my legs. I feel lighter in my whole body in general. Even my head, my cerebral, like my
Yeah, the
my
thing called
mental.
brain. Yeah, brain. Yeah, gotcha.
Like I feel
Right,
less
gotcha.
that fog, the fog, the
Fog,
mental
yeah.
brain.
He's just
fog
putting words
thing.
together right now because it is true. He's actually feeling less brain fog right now because we just affected his brain by adjusting his spine properly. So anything else? How's your headache? You were at 8 before, or 7, I forget what it was.
It went down to a 5.
Yeah, so different, right?
And even my neck feels less pressure, build up,
Gotcha.
inflammation. Oh man,
That was a 7 a minute ago.
it's a 5.
That was an 8, I think, a minute ago.
It's a 7.
That was a 7, I think, a minute
It's
ago.
a 5.
Range of motion has changed dramatically on him. What's that?
It's a 5. What?
What do you mean? What?
It didn't snap. My knee didn't pop. Or
Yeah, but how much
snap.
pain? You were at 8 a minute ago.
I'm like a 5.
Yeah.
Feel
Go
like
stand up.
but I can still feel it in my back and,
Yeah.
and less on my legs, my knees.
Right? Did I touch your legs?
No,
Touch your
at
legs?
all.
Gotcha. Now stand up on your toes 5 seconds. What do you mean what?
Yeah, less trembling, less like my legs feel stronger.
Yeah,
like
yeah,
even
yeah.
my balance is a little bit
Yeah,
better.
it is. Now how about your pain in your feet?
It decreased. It went down to a 5.
What do you think, dog? What do you think?
You're amazing.
I know.
You
but
got
what do you,
magic in your
I
hands.
get it. Tell them.
I feel great. I feel
awesome.
much better.
Say hi to your fans over there.
Everybody, I
Cheers.
feel
Cheers.
much better just right now. And whoa.
Why the emotion?
I can't even control it, man.
Why the emotion?
What a relief. Yeah. It's like, because I was carrying, like somebody was just this constant, and it's just like
Where are you at with this whole process?
pain relief and education, a lot of education.
Do you have hope? Do you have some hope?
Oh, yes, I do.
How painful is this?
Ooh, it's like an 8,
An 8? Gotcha.
8.5.
Good. Stay right there. What does that feel like? Besides me letting go of your shoulders, but what does that feel like?
Relief, relax. Like pressure being relieved.
Because he's always stressed, he has created scar tissue right at this joint right here. Good boy, there we go. So we're adjusting right here at C6, C7. I'm gonna go right down in here again. And he'll tell you what this feels like when I'm done. Lower this left shoulder, please. Good.
It hurt, but after that, it's just relief of pressure.
Tell us what the last 4 days have been like for you.
I do see the changes in my body and my mind. Very difficult, very challenging, but not impossible. You have to do the due diligence. I'm a little bit behind, but I will catch up. My body is asking for it. I really want it. And I do feel the slight increments of improvement. And
Gotcha.
that motivates me and inspires me to keep on pushing it.
He says all the right things, but it's not necessarily taking to it yet. But I'm hoping that this weekend is going to be the difference maker, so he can catch up. Because
Yes.
he says the right things, but he doesn't. The action is not there. So we've stopped him now from taking cannabis anymore because I'm going to get his
Right.
mind sharper. And then we've also told him he needs to be more accountable, and he is taking the steps. And so far, so good. Neck pain. How has our neck pain been since the beginning? Just give me your
10%.
honest 10%. Any better in your headaches?
10%.
In your shoulder blades here?
10%.
Carpal tunnel, wrists,
10%.
feet,
15%.
constipation,
15%.
lightheadedness, dizziness,
10%.
low back pain on the right side.
10%.
How about your sleep?
I would say 20%.
Anxiety, depression every day.
20%.
And then your left ankle.
10%.
So you see that we haven't made huge strides with him. But again, granted, he's about 2.5 days behind on treatment, not on treatment, on follow through. I give him tons of homework. He hasn't followed my instructions to the letter yet. Last night he had his first great night's sleep, I think. I would say
Yes.
that. And so he's going to catch up. I believe in this guy. He would tell you, he'd be the first to tell you that this is tough love here.
It is.
And I think that he actually appreciates it.
I do.
But he needs to catch up big time.
Which I am. Something that I've dealt with, which a lot of men deal with. This is personal and private. But I feel that any guy, any man out there seeing this video, I've dealt with dysfunctional erection problems, like with the little guy downstairs, and every adjustment, I'm just focusing on listening to my body. There's no feminine energy, there's traffic, cars, and I get an erection, and I'm just walking. I'm doing my therapy, and there's blood circulation going down there. And in my most recent relationship, that created conflict between us, and she almost left me because she thought I was with other women, which that is not the case. It's just stress, insomnia, depression, anxiety, all of that affected my ability to perform sexually. So I can't wait. I haven't done any sexual activity. She's waiting. She wants me to just focus on this, and I will tell Dr. Taylor, and I will share that with you, with everyone, because it's something that we men, it's very difficult. I even confessed to her, and I almost lost her. And so if any of you guys out there are having problems or difficulties down there, maybe a neck adjustment might just help you out.
Wow. I didn't think he was going to share all that, so I appreciate that share. A couple other things I forgot to talk about, which he's brought up many times. Talk about your vision, your hearing, your smell, your taste. What about those things too?
I have hearing loss. It has actually increased it, amplified it. I can hear my voice. The tone of my voice is different. As far as my vision, it has opened it up. It's less cloudy. And even my vision, my mental, less brain fog, less. It has decreased. Even my
taste,
sense
smell.
of my smell. I have actually had an injury in a mosh pit. As a musician, I lost a great sense of smell. Even that, I'm picking up things. And my hearing, for example, I'm always talking with my girl over the phone, and after the second adjustment, I heard the baby, and she's like, we've been talking for all the time. There's been a baby. This is the first time you notice it. I'm like, because Dr. Taylor, the adjustments. So even and another thing, even my sense of taste, because now I'm even eating slower. I'm flavoring. I'm savoring things. Like I take my time, and I'm chewing. I'm making more into mush. Back then I would just chew and swallow, and I don't really take the time to enjoy anything. Walking. Now I'm pacing myself. Even showering. All these little things.
Talk about your stomach too. About eating in the morning.
For the past 5 years, I had no appetite until past 5 p.m. And I've literally been going 24 hours with only one meal per day. Now I wake up and I'm hungry. I'm starving. Like right now, my stomach is grumbling. So even my sense of appetite, it has increased. I've been eating a lot too, and staying hydrated, and my bowel movements have improved too. I'm using the restroom twice per day. And they're smooth. One was so smooth, I think when I cleaned with wipes, there was nothing. I was just like, wow. Like, I don't even have to clean myself anymore. Like, that's awesome.
Anyways, great share, guys. Great share. Thank you so much for that. And again, even though his pain seems to only be 10% better to 20% better, the things that I really care about is his body's turning on and it's actually working. And we know that from this. So, anyways, let's get him treated. How tender is this?
It's an 8.5.
Yeah, it doesn't feel as bad as usual, guys. I mean, say me 8.5, but it doesn't feel as bad to me.
It hurts too.
Wow, yeah, I get it, but I can feel the range of motion on it. Okay. Ooh-wee. Yeah, that moved really good, guys. I worked, yesterday I worked C6, C7, which you guys saw that video. And today I went back to C2, C3 this time. Went a little bit higher. We also figured out that he has a left atlas problem really bad on the left side. And so that's all going to be worked on Monday.
I feel a really sharp pain from like the top of my head all the way.
The reason he feels that is because we're right in the right area to fix him. And so he's feeling all the repercussions from the adjustments. I'm going to go right back in here. The left side is really the issue, guys. So I'm going to take my time on this side. Right there. Right there. And so why does it hurt right here? I want to push down here. This is all sensitive in here. Yeah. But right here is really bad because that's the reverse curve right here. That's putting the most pressure on his atlas on the left side. And again, next week we adjust his atlas. We're going to get this side to loosen up. We're working on a curve, the structure of the neck. Drop your head, please. Drop your head. He's a little scared because you can feel it building up pressure. There we go.